Why is monitoring blood pressure during pregnancy so important, you may ask? Let's unpack that. Throughout the miraculous journey of pregnancy, the expectant mother's blood pressure, which is essentially the force of the blood against the walls of her arteries, naturally fluctuates. These slight variations are typically normal, part of the body's way of accommodating the growing life within. However, it's when blood pressure remains persistently high or spikes suddenly that it becomes a cause for concern. These changes in blood pressure can signal underlying complications that pose a risk to both the mother and the baby. Conditions such as preeclampsia or gestational hypertension can emerge, which, if left unchecked, can lead to serious complications such as preterm birth, low birth weight, and even maternal organ damage. As we see, the importance of tracking blood pressure during pregnancy is profound. Let's take a look at Sarah's story. As a first-time expectant mom, Sarah was sailing smoothly through her pregnancy. But as she entered her third trimester, a routine checkup threw a curveball her way. Her blood pressure, which had been normal until then, shot up unexpectedly. This sudden spike was a red flag for her healthcare providers. It led to a swift investigation and the diagnosis of preeclampsia, a condition that can be life-threatening for both mother and baby. Characterized by high blood pressure and potential organ damage, preeclampsia is a silent predator that often goes unnoticed without regular monitoring. But thanks to the vigilant eye of her healthcare team, Sarah's condition was identified early. This allowed for immediate treatment, mitigating the risks associated with this dangerous condition. Vigilant monitoring of Sarah's blood pressure allowed for timely intervention, averting a potential calamity. And that, folks, is the life-saving power of keeping a close watch on blood pressure during pregnancy. Now, let's shift our focus to Maria's journey. Maria, already a mother of two, was well acquainted with the rigors of pregnancy. However, during her third pregnancy, she noticed something different. Her hands and face were persistently swollen, and she experienced relentless headaches. Wisely, she didn't ignore these signs. She reached out to her obstetrician, who immediately conducted a blood pressure check. The results were telling. Maria's blood pressure was notably elevated, indicating a potential problem. After further tests, she was diagnosed with gestational hypertension, a condition characterized by high blood pressure during pregnancy. This was a new challenge for Maria, but she was ready to face it head-on. With the guidance of her healthcare provider, Maria implemented lifestyle changes and closely monitored her blood pressure. It wasn't easy, but her vigilance paid off. Through close monitoring and lifestyle changes, Maria successfully navigated her pregnancy, minimizing risks. The stories of Sarah and Maria underscore the pivotal role of early detection. High blood pressure during pregnancy can manifest in several ways, from gestational hypertension and preeclampsia to exacerbating pre-existing conditions like chronic hypertension. If left unchecked, these conditions can lead to serious complications, such as preterm birth, low birth weight, placental abruption, and even damage to the mother's organs. But the good news is, with early detection and intervention, these risks can be significantly reduced. Regular blood pressure checks offer a tangible, simple way to monitor both mother and baby's health, providing reassurance and fostering a sense of control. And it's not just about clinical outcomes. It's about empowering expectant mothers to actively participate in their care, fostering a collaborative relationship with their healthcare providers. As we've seen through Sarah and Maria's stories, the power of monitoring blood pressure during pregnancy is undeniable. It's a simple yet life-saving measure